All right, guys, we're going to go over shoulder and upper arm and massage techniques class. All right, so what the learning objective is going to be is it's going to help us to identify bony and soft tissue landmarks of the shoulder and upper arm. We're going to learn how to perform accurate palpation techniques on the shoulder and arm, recognize signs of common shoulder conditions, and then apply palpation findings to assessment and to help treat, as well as plan if the first treatment didn't do enough work. Shoulder anatomy. So I know you've learned the anatomy, but this is what you guys need to make sure you know when palpating and applying what you know to hands-on. So the three bones that I really want you to know are the clavicle, the scapula, and the humerus. Joints, you got your glenohumeral joint, your acromioclavicular, and your sternoclavicular joint. And we did just go over all this in our Kinesiology 1 course. You can find that video under the Kinesiology playlist. All right, muscles. The muscles associated with moving the shoulder joint would be your deltoid, your rotator cuff muscles. There's 4 of them. Biceps, triceps, pec major, pec minor. Some other structures to get familiar with are the bursa that surrounds part of the joint, tendons, and ligaments of the joint. So just a quick overview of the bones. You got your clavicle, which is your collarbone, your scapula. Second picture, highlighted in green, would be your shoulder bone. Scapula, shoulder. Humerus would be your upper arm. And an easy way to remember that is your funny bone. If you hit it, it's not very funny. Ha ha, humor. Get it? Humorous bone. All right. The joints. Here's a whole list of the joints, but the main ones I want you to know are your glenohumeral, acromioclavicular, and sternoclavicular joints. I have a little green check mark or a little box right next to the ones I want you to know. But you are going to have to get familiar with the rest of the joints of the body as we learn each section of anatomy and muscles. Again, your key bony landmarks are going to be your acromion process. All right here. All right, you have your coracoid process and then your spine of the scapula, which your spine of the scapula kind of turns into the acromion. So this is going to be a fast video just because you guys have learned it. But make sure you get familiar with that. Right? There's also the borders of the scapula. Right? So you have your lateral border, your medial border, your angles. Inferior is lower, you are inferior peasant to the superior angle on the top, which is the superior king or queen, right? All right, some more landmarks. So these are looking at bony landmarks, again, of your humerus, your upper arm bone, right? So we're talking about the tubercles. You have a greater and you have a lesser. So in this picture here, if we're looking at the greater, it's going to be on this side here. Your lesser will be in the front. Yes. And right down the center, you have something called the bicipital groove. They also call that intertubercular groove, right? Like tubercle, right? Makes sense. Towards the end, about middle here, you're going to have something called the deltoid tuberosity, which I have a red dot here. This is where your deltoid connects onto your humerus bone. Bicipital groove is where your bicep runs along that groove to connect to the bony landmarks of the scapula. And if you need a refresher, check out Kinesiology Chapter 2, right? Key muscles to know. Your deltoid. All of these 4 are your rotator cuff. So your supraspinatus, infraspinatus, subscapularis, which is underneath, and your teres minor all hanging out together. You also need to know where the biceps and the triceps are. Now, there's some common conditions that happen at the shoulder joints. All right, this would be 1, shoulder impingement, right? Rotator cuff tendonitis. So remember, itis always means inflammation. So that would be inflammation of the rotator cuff tendons, right? There's 4. Typically, it happens often with the supraspinatus. Then we also have rotator cuff tears. So that is when there's a tear in the muscle or tear in the tendon. Typically the tendon connecting to the scapula. Or I'm sorry, the humerus, right? So then we also have frozen shoulder. The fancy word for that is adhesive capsulitis, right? You can call it frozen shoulder if that's too much of a mouthful. Next in line, bicep tendonitis. That is when your bicep tendon gets inflamed, right? You also have labral tears. Remember in kinesiology, I explained that there's in your ball and socket joints, there's something called a labrum that kind of lines the inside of that joint that can tear, okay, and cause a lot of pain, discomfort, and mobility issues. Also, you have shoulder dislocations, or you can call those subluxations. Subluxations are when you have the articulating surfaces of the joint, and it's kind of not where it's supposed to be. So a lot of chiropractors deal with subluxations with the vertebrae in the spine, where maybe it's moved a certain direction, rotated, or a little cockeyed from where it's supposed to be to function correctly. Last but not least, we have bursitis. So again, you have a sac that kind of forms around a joint to restrict rubbing of structures. It's fluid filled, causes gives you a little lubrication for that joint. That can become inflamed and cause pain as well. All right, let's talk about this shoulder impingement just a little bit more in detail. So here is a picture of the supraspinatus tendon, and you get to see the bursa sac. See how the bursa is kind of giving you a little bit of like a cushion between, the clavicle, the acromion, and the humerus here, right? So with shoulder impingement, typically when you palpate the shoulder, you're going to find some tenderness around that tendon of the supraspinatus. And then the client will typically have pain with any overhead motions, right? Because remember, the supraspinatus will abduct the shoulder joint, right? So if you have pain doing that, there's going to be issues with that joint or with that tendon, sorry. Causes: repetitive overhead activity, poor posture, muscle imbalances, trauma. So even falling on that shoulder can cause trauma here, right? Key signs would be a painful arc in that shoulder, weakness with abduction. So here is a little picture here. It says reduce subacromial space. So sub below, acromion, subacromial space. So see how there's less space here. It becomes inflamed. And then sometimes that inflammation and the rubbing can eventually cause tears in that tendon. And then you're looking at good old surgery, hopefully. Hopefully not, actually, but rotator cuff tendonitis. So here's a fun picture of some tendonitis. It looks like you got a small tear going on here of the rotator cuff. Remember, tendon is a tendon that is inflamed, itis. Palpation findings. There's going to have tenderness at the supraspinatus insertion or the bicipital groove. So typically you're going to have, remember the insertion for supra and infra and teres minor all are the lesser tubercle. So you can have tenderness here and at that bicipital groove. And a lot of times you're going to have referred pain in the deltoid. So if you have rotator cuff issues, a lot of times you'll have referred pain right in that deltoid muscle. Let's see. Symptoms: achy pain that worsens when lifting or reaching. Alrighty, so Remember, the supraspinatus does that abduction. Palpation tip, explore for swelling or thickening of the tendon. So if it feels like it's warm, red, inflamed in that area, have them seek more help, see their doctor, sports medicine doctor. They might need to have further testing or images or physical therapy to kind of work out this problem. Here's a tear. That's fun. Again, we're talking about that supraspinatus, remember? That muscle up here, right? So you can have a partial tear or a full thickness tear. In this picture, this is a full tear. A partial, it would still be connected at some point. Also, I'd like to throw in here, typically it's pretty common when you have a rotator cuff tear that you also have a bicep tendon tear. So typically they have to go in when they repair this tear and repair multiple tendons. Findings when palpating would be tenderness over your greater tubercle, atrophy in chronic cases. Atrophy would be like the muscle wasting away, so maybe the muscle tone is a lot less than the other side or than it should be, okay? And that's in chronic cases because you're not using that muscle. If it's torn, it's no longer being used to lift that arm. At this point, you are having other muscles kind of chime in to do all the work since that muscle is no longer in function. So just think of that muscle as a car that needs towed. It is no longer doing anything. It is stuck on the side of the highway. Symptoms would be weakness, pain at night, maybe leaning on it. If you're laying on it, it's going to be very painful. And difficulty and pain lifting your arm up. Frozen shoulder. All right, here's a picture here of frozen shoulder. It is the inflamed shoulder joint capsule. So that whole shoulder is inflamed. All right, it's going to cause a lot of pain and you're not going to be able to have full range of motion in that shoulder, hence it being frozen. It is stuck per se. Palpation findings would be diffuse tenderness, tightness around your joint capsule. So there's different phases for frozen shoulder. They have the freezing, frozen, and the thawing stage. Freezing would be increasing pain and your limited range of motion. Frozen at this point would be stiffness with less pain. And then thawing would be your gradual return to having full mobility or as good of mobility as you can have considering the injury. So a palpation tip here would be to gently mobilize the joint during an assessment or maybe have your client actively do it themselves. Ask them like, all right, how far can you lift your arm this way, and do an assessment that way. You might need to assist them, right? Or if you want to, you can passively just have them relax and go through the joint motion just very carefully, okay? Bicep tendonitis. So remember how the bicep can be injured with rotator cuff injuries? Well, you don't even need a rotator cuff injury to have tendonitis. So either head of your bicep can become inflamed, right? So palpation findings would be tenderness along your bicipital groove. Symptoms, pain with elbow flexion and forearm supination. So remember, the bicep doesn't only flex the elbow, it flexes the shoulder as well, and it supinates the forearm a little bit. So if you're having pain there, it's probably going to be associated or can be with tendonitis of your bicep muscle. Now, the bicep tendonitis often coexists with good old shoulder impingement or the rotator cuff injuries. But like I said, it can also happen on its own. Some other conditions. We have labral tears. So here's a labrum, and here's the tear. See how it will create little lacerations? So the labral tears, you would feel a deep joint pain, clicking or catching sensation, limited range of motion. or pain with certain movements. That's not listed, but I know from experience with a labral tear in the hip. So you can have a labral tear in the hip or the shoulder joint. Number 2, we're going to talk about subluxations or dislocations. This diagram here has a dislocated shoulder, and up here. Well, I guess it's not. That's just showing the labrum. Just kidding. So this this X-ray here has a dislocated shoulder joint. Right, so that doctor's got to pop that baby back in. So when you have that dislocated shoulder joint, you're going to probably have injuries to the ligaments that were holding it together. All right, so that might cause some soreness, swelling, inflammation until those ligaments heal. All right, so with this, you might have pain and deformity. So it's going to look kind of weird. Your shoulder is hanging at your side and you don't have that capacity to move it, right? Guarding. So guarding means you're keeping it from moving. Other muscles are probably engaged to keep it from moving, to compensate. When you have this going on, you want to avoid deep palpation, especially during the acute injury. So acute can be days or weeks depending on the issue and how it started. So you shouldn't do deep work on any acute injury. So just be mindful of pain and how deep you are palpating or, massaging your clients. Last one, bursitis. So in this picture over here, there's a bursa sac. It keeps things from sliding together uncomfortably, right? So you can have localized swelling and tenderness, and often it is subacromial. So often you are having it right under the acromion process there. So if you have bursitis, typically they might give you injections or NSAIDs or steroids to kind of bring that inflammation down. Ice is your best friend. All right, some palpation red flags. All right, severe pain needs light palpation. All right, always check in with your client if there is an injury that you are not hurting them and causing things to be worse. Red flag would also be sudden loss of mobility. If they don't have any mobility, I wouldn't really work on that joint until they see a doctor. You can work around, like above or below it, or other parts of the body. But if there is sudden loss of mobility, send them to the doctor. They can have, images, X-rays, MRI, whatever they need to figure out what's going on. Numbness or tingling in an upper extremity. So numbness and tingling almost always means there is a nerve being pinched, right? So you want to get to the root of why it's being pinched. If it's not muscular, it's going to be pinched because of maybe a bone-on-bone situation, degeneration of the cervical spine, something like that in the upper arm. So numbness, tingling means typically there is a nerve involved. Acute swelling, bruising, or deformity. If you have swelling, bruising, or deformity, do not work on that area. Send them out the door and have them see their doctor. All right, if you suspect a fracture or severe tear, refer out. This means doctor. So I'd say most of these, if there's something going on, don't work the area until you find out more of what's going on and have your client see their doctor, okay? Practical tips. Always warm your hands before palpation. So hands are cold sometimes after washing your hands. They will warm with time, but also keep that in mind that you don't want to just put your cold hands right on somebody if you can help it, right? Maintain good therapist body mechanics so that you don't injure yourself while trying to help someone else. You want to document pain levels, locations of pain, any tissue texture changes, any changes at all with your client, and issues that they might be having with, their muscles. Then you want to correlate any palpation findings with movement testing. So that would be maybe completing some range of motion on specific joints to see if there's any improvement before or after the treatment. You can just kind of gauge when to do that and when not to. All right, so this is a little hands-on thing. You can do that with somebody at home. You can do that with your classmates when we do our hands-on therapy. So when you guys do partner up, just kind of feel around and see if you can identify any bony landmarks. Try to identify muscles. You can feel along the belly. The belly is a thicker section before it branches off into the tendons. You can kind of feel all along that muscle gently. Don't palpate too hard. And when you palpate, make sure you use the pads of your fingers, all right, and not just like fingertips because that's painful. So identify a couple muscles if you can. Practice palpating the bicep tendon and your supraspinatus origin, all right, or attachments. All right, and I have a couple different books that I referenced to make this slide. You guys have the Tapman's Handbook of Massage Therapy, also Trail Guide, awesome book for anybody who wants to do anything that correlates with the body or anatomy. It's just a really freaking awesome book. And then the Orthopedic Assessment, you guys can look into that book as well if you are interested in learning more.